name is Tasha Vogel. My student number is 100689238. I forgot my student ID card, so yes. My clinical instructor assigned me acetaminophen to give to Robbie Robertson, and now I'm going to do some critical thinking. So my drug is acetaminophen. Its functional class is non-opioid analgesic and an antipyretic. Its chemical class is a non-salicylate paraminophenol derivative. Its action, it may block pain impulses peripherally that occur in response to inhibition of prostaglandin synthesis. It does not possess anti-inflammatory properties. Its antipyretic action results from an inhibition of prostaglandins in the CNS and hypothalamic heat regulating center. So the pharmacodynamics are, its onset is half an hour to an hour, its peak is 1 to 3 hours, and its duration is from anywhere from 3 to 4 hours. The contradictions are hypersensitivity to this product, aspartame, saccharin, tartazine, and phenticin. And pregnancy, and its precautions are pregnancy, breastfeeding, and anemia, renal, or hepatic disease. The dosage for an adult by mouth is 325 to 650 milligrams every 4 to 6 hours per needed. Adverse effects are nausea, vomiting, abdominal pain, rash, and urticaria, and its lethal effects are cyanosis, anemia, neuropenia, jaundice, CNS stimulation, delirium followed by a vascular collapse, seizures, coma, and death. Okay, so now I'm going to verify with my MAR. So I'm going to locate my medication, and because my medication is a ward stock, it's not going to have my patient's name. So first I'm going to do my first check. I have my right patient, which is Robbie Robertson, the right drug, which is acetaminophen. My right dose is 1 to 2 tabs. My right route is by mouth. The time I'm going to give the medication at is at 9 o'clock a.m. The right frequency is every 4 hours. The right route isn't applicable because it is by mouth, and the right reason is to help with his pain from his UTI. I am now going to look at his allergies, and I see he has an allergy to codeine, and I'm going to write that down. And then I am going to check, and I see that the night nurse has signed the MAR and has verified it. I am also going to do my dosage calculations. So my doctor has ordered 1 to 2 tabs, and from my dosage on my drug guide, I can see that the right quantity is 325 to 650 milligrams. So if, depending on my patient's pain, I can give him 1 to 2 tabs, and it will fall in the correct range or correct dosage range for an adult patient. I am then going to do my second set of writes. Once again, this is a ward stock drug, so it's not going to have his name on it. So I'm going to look again at right patient, which is Robbie Robertson, right drug, which is acetaminophen, right dose, which is 1 to 2 tabs, right route, which is by mouth, right time, I'm going to give it to him at 9 a.m. Right frequency is every 4 hours. Right site isn't applicable because it is by mouth, and right reason is because I'm going to give it for his pain from his UTI. I am now going to administer or dispense his acetaminophen. And before I had checked his pain and he rated his pain on a scale of 8 out of 10. So I'm going to administer 2 tabs of acetaminophen. And once again, I'm going to do my last check. Because it's a ward stock, it's not going to say his name. But my right patient is Robbie Robertson. My right drug is acetaminophen. My right dose is 1 to 2 tabs. My right route is by mouth. The right time is I'm going to give it to him at 9 o'clock. Right frequency is every 4 hours as per needed. Right site isn't applicable because it is by mouth, and right reason is because I'm going to give it to for his pain from his UTI. So before I go and administer the acetaminophen, I am going to write down 3 identifiers. So Robbie Robertson, so I'm going to write his name. I'm going to write his date of birth. And then I'm going to write his UI number. And I'm going to highlight that he is allergic to codeine. Okay, I'm going to go find my patient. Hi, my name is Tasha. I'm a second-year nursing student at Ontario Tech U, and I'm going to be administering your acetaminophen for your pain from your UTI. Is that okay with you?
Yes.
Can I get your name?
Robbie Robertson,
And your date of birth?
March 14th, 1947.
Okay, and I'm going to check your wristband for your UI number. So I see that his UI number on his wristband is 075432, which matches the one I wrote down from his MAR. So if you have any adverse side effects such as nausea, headache, or vomiting, you can notify us via your call bell, and we will come and help you. So this is your. Do you have any other allergies other than codeine?
No.
No? Okay. So this is your medication. And here's some water. Okay. So now that he's taken his medication, I'm going to go sign off on the MAR. So I'm going to write my initials under beside the 9 a.m. And then on the back of my MAR. And I am a and now I'm finished giving medications.